All righty. Well, welcome everybody to our October MOTA CEU. I'm Clarice Miller-Grody. I'm the Director of Practice for the Missouri Occupational Therapy Association, and we have Regina here today to talk to us about animal-assisted therapy. I did want to go ahead and orient everyone while I've got you here to our website and what kind of the CEU page looks like if you haven't been there. So this is our CEU page. I just finished on kind of updating it. So as you can see, usually here at the top, we're going to have our monthly CEU as well as our webinar and the post-test link. And I'll go ahead and get the slides uploaded here in a little bit. I also want to make sure you guys know that we also have district CEUs that you're eligible to take. Even if you're not part of the St. Louis district, you can still take these CEUs and receive credit for them. They've been well put together. A lot of them are about our practitioner well-being and those sorts of things. And then down here at the bottom, I've redesigned how you can find our previous CEUs. So all of our previous CEUs are still free to members. You're still eligible to take them, each for 1 credit hour each. So I have the recorded webinar, a post-test link, and the slides. Please remember that only MOTA members are eligible for our post-test and for the CEU credits. So if you have those links, please don't share them with others. This is something that we want to provide exclusively for you all as appreciation of being a MOTA member. So with that said, I'll go ahead and stop my screen share. And we have Regina here today. She's going to talk to us about animal-assisted therapy. We're really grateful to have her here. And so Regina, I'll let you go ahead and tell them about yourself and whenever you want to start.
I'm Regina Abel, and is that showing up now? I need to get shared. Are you seeing that?
Yes, looks good.
Looks good, okay. I'm Regina Abel. I've been in the program of occupational therapy at Washington University for about 20 years now. I can't believe that. Most of that time I've been in research, and I've been teaching for about the last 5 years. And I also mentored OT students. I've been working with animal-assisted therapy for about 20 years, and I've been doing research on it now for about 7 to 8 years. So I'm going to go through the background of OT today and then some of the work that we've been doing. If there's anything you want to know as we go along, feel free to just jump in and ask. And do you want me to go ahead and start?
Regina, you might need to be a little bit closer to your mic. It's kind of a little muddled on your end.
Okay. Is that better?
Yes, that's better.
All right. I'll yell. Okay. So the title of the talk is Animal-Assisted Therapy as a Complement to Occupational Therapy. So it's ways that you can use animals and incorporate it into standard occupational therapy, and as well as using it on its own. Liz Auerbach and Nola Lewis and Campus Systems Dog contributed information for this talk, as did Deborah Bellum, who is a social worker and ombudsman for long-term care facilities in Illinois. So there's no psychiatrist in the world like a puppy licking his face. And I think when people think about animal-assisted therapy, that's what they typically think about, is this idea of, well, the dog makes you happy or the animal makes you happy. And it does, but there's a lot more going on, and we're going to talk about the other ways that animals make a difference. So we'll start out by introducing some terminology that has to do with animal-assisted therapy, review the history of animal-assisted therapy, identify the means by which therapy dogs can increase the quality of care using a threefold benefit model, describe research on animal-assisted therapy, identify potential benefits and drawbacks of implementing an animal-assisted therapy program in the institution, and detail laws regarding service animals. I have to first introduce you to my research assistants. This is Dolly on the left, Laura in the center, and my bagel, my basset beagle, Wally, on the right. And they've all participated in the research in one way or another. So starting with terminology, human-animal interaction, or HAI, encompasses any situation where there is interchange between humans and animals at an individual or cultural level. And this is a term you'll come upon quite frequently when you are looking into animal-assisted therapy, HAI, or human-animal interaction. The American Veterinary Medical Association's committee defines the human-animal bond, or HAB, as a mutually beneficial dynamic relationship between people and other animals that is influenced by behaviors that are essential to the health and well-being of those. So this is something we in the business are always concerned about, is that it also benefits the animals. Assistance dogs are guide dogs, hearing dogs. The guide dogs are like the seeing eye dogs. The hearing dogs are for people who are hearing impaired. And service dogs assist people with disabilities other than vision or hearing. This particular dog here was trained by a camp assistance dog, and it serves both of these children. And then I think this is a familiar person to some of you. This is Dr. Carrie Morgan and her assistance dog, Whit. One thing about assistance dogs is they are trained from the time they're like 8 weeks old. So from the time they're very tiny, they're trained to work for like one particular person, and they're working dogs most of the time. Therapy dogs, on the other hand, are pets first. So they'll start out as being our pet dogs, and then they go through training, a period of 12 to 16 weeks of training, and are certified then as therapy dogs. And they just visit, so they continue to live with their owners, and they just visit various facilities. There are 2 types of work that therapy dogs do, and one is animal-assisted activities. And I think that's more what people think about when they think about therapy dogs, visiting the nursing home or the hospital and going room to room and just carrying people up. But there's also animal-assisted activities, or animal-assisted therapy, rather. And that is when the dogs are used as tools. They actually work with the therapist like the picture on your left here was actually at the Rehabilitation Institute. The picture in the middle is the Cardinal Lenin. I'm not sure if the picture on the right was taken. That's animal assisted. The one on the right is animal assisted activities, and that dog is just carrying that young lady up. But the other 2 dogs are actually working on goals with the patient. And now I want to talk some about the history of animal assisted therapy. And it really begins with cavemen and wolves. There's such a long history of humans and dogs. And really, some people believe it began when colonies of humans became large enough that they had dumps, that they were able to, they had garbage to throw away, and the wolves would come up and scavenge. And some of those wolves would be tamer than others, and those were domesticated. And over the years, humans have bred dogs to do all kinds of jobs. So they were bred for specific functions, everything from being a lap dog to being guard dogs. The first documented case of animal-assisted therapy was as early as 1792. And it was in England at York Retreat, which was an asylum run by the Society of Friends. William Tuke used common farm animals as part of the treatment process. And he stated that incorporating rabbits, chickens, and other farm animals would enhance the humanity of the emotionally ill. And as a means to control patients, Tuke found that farm animals lessened the use of drugs and restraint. That was as far back as the 1700s. In the mid-1800s, Florence Nightingale once said that a small pet animal is often an excellent companion to the sick. During the late 19th century, companion animals became increasingly common features in mental institutions in Europe. It became common in Europe somewhat before the United States. Animals in these institutions provided a less prison-like atmosphere. In 1919 was the first documented use of animals in a therapy setting in the United States. Dogs were incorporated into the treatment of psychiatric patients at St. Elizabeth's Hospital in Washington, D.C. Their intended use was just as companions for the patients. The top right picture is Sigmund Freud with his Chow Chow jockey. He was known to have in many of his sessions with his patients. And in the bottom, that is, in 1964, child psychologist Boris Levinson first coined the term pet therapy for his dog Jingles. And I wasn't able to figure out which one of those dogs was Jingles, although I did try. Levinson also explored the role of animals in relation to patients with chronic mental illnesses who live in supportive care. After bringing puppies into the supportive care for visitation, patients reported less depressive symptoms in the group who did not interact with puppies. And this is the first that you really noticed that there was some of the first research into the effectiveness of animals with patients. By the late 70s and the 1980s, this marked a turning point in the growth of animal-assisted therapies as a accredited field. And I'll talk about the threefold benefit model of therapy dogs. One is physiological. So how do these dogs affect the physiology of patients? The second is psychological, and the third is social and emotional. Don't freeze. This isn't on the test. But what this is really saying is that when you have an action, there's a reaction, and from the reaction, you have an interaction. And there's both a physiological and an emotional response to an action. And the emotional response becomes social behavior of some sort. And this can be interspecies, that is human-human and animal-animal, or interspecies, which is human-animal interaction, which is an affiliation and becomes a therapeutic agent. If there's a physiological change, this interaction causes a physiological change. The neurochemicals for experimental support coming here and actually affect this interaction, this human-animal interaction, or physiological changes. This title, Animal-Assisted Therapy, Magic or Medicine, is the title of an article by J.S. Odendahl. It's one of my favorite studies. Feelings of attachment are biologically, psychologically, and culturally shaped. Like when a mother gives birth, there's this biological response to the child, and it's caused by neurochemicals and hormones and so on. And then there's the secondary intellectual fine-tuning. So then the more you reward it, the stronger this bond is. This is much the same thing, that it happens instantaneously and involuntarily. And when Odendahl had pet owners pet their dogs, what he found was that there was an increase in beta endorphins, oxytocin, prolactin, beta phenylethylamine, I can never say that word, dopamine, and cortisol. These feel-good chemicals rise in the dogs as well as the humans. The only thing that's different is the stress hormone cortisol lowers in humans and increases in dogs. So interacting with dogs lowers the stress of humans, but it somewhat increases the stress in dogs. The dogs are working. When you pet your dog, you know how excited they get, and that's partly due to rising cortisol. Engelman in 2013 found that pain reduction in hospice patients and reduced stress of medical staff. They had 19 palliative care patients that were visited over the course of a year. Self-reports, staff observations, and staff responses concluded that therapy animals can be an effective means of temporarily reducing pain. The presence of the therapy dog reduced their anxiety as they petted the animal and became more relaxed, which temporarily distracted them from the pain. And the presence of the therapy dog appeared to reduce the stress of the medical staff. Working on stretching or something that's painful for a patient, they'll actually have us bring the dog to the patient, and the patient pets the dog, and that relieves some of the pain that they're going through when they're going through stretching and so on. Marcus found clinically meaningful pain relief. Patients receiving treatment for fibromyalgia in an outpatient pain management facility, if they interacted with dogs, they self-reported pain severity was reduced significantly. And 34% of patients demonstrated clinically meaningful pain relief. So there again, when you use the dogs in situations where your patient is in pain, it will actually clinically reduce the pain. The study also found significant improvements in mood and other emotional factors resulted from visits with the dogs during treatment. And you can see with the look of pleasure and relaxation on the face of this woman who was actually going through pain treatment. There are psychological benefits to therapy dogs as well. The effects of therapy dogs on residents with multiple mental illnesses, including dementia, psychosis, and depression. Weekly visits improve cognitive functioning in dementia patients. And they evaluated the effectiveness of animal-assisted therapy on geriatric patients diagnosed with dementia. And they found that there is a calming effect, and it also affects seems to affect memory and cognition. And there's social emotional benefits of therapy dogs. It enriches the social environment. Attachment support helps elderly cope with loneliness and depression. So someone who's living alone, if they have pets, or if the pets visit, if they're in a long-term care facility that either has pets on the ground or have regular pet visits, it actually decreases loneliness and depression. It reduces loneliness in residents of long-term care facilities. Now I'm going to talk a little bit about some of the research that my students are doing right now. The first is the effects of animal-assisted therapy on pediatric occupational therapy. And what we do is we bring the dogs into just a regular pediatric sessions at Paraquad. So they work with the therapist there. And we don't tell them in any way how to use the dog. They can actually use them as tools, or they can just have the dog just be there. We videotape everything. You can see a camera in the back here, and there's our 2 other cameras. We usually have at least 3 cameras recording the session. And we later evaluate that with a program called VORUS, which is Behavioral Observation Research Interactive Software. I can never remember that. But we play it back, and when we do, we have this whole list of behaviors, and we watch a few at a time, so it takes a long time to watch all the videos and record what's happening. But we can find out what the dog is doing, what the therapist is doing, what the child is doing, and what the handler is doing. So we can end up with a full picture of what is happening during these sessions. And it helps us understand how the relationship of the dog and the therapist and how everything works together. These are the 6 therapy dogs that have taken part in this study. one of the problems with much of the early research is that they would only use one or two dogs, and then it's hard to generalize. You don't know if it's just that dog or that handler. And this way, we have the 6 different dogs. We try to use one dog per child. It's not always possible to do that with everybody's schedules, but we let them build a bond with the dog. And so you can see we have a pug and a collie, my basset beagle, my Abel Wally, a golden retriever, a border collie, and a golden beauty. And they're all quite good at what they do. Just as a general idea for this is the children. We have 4 children at the time that we were collecting this data. And you can see by the behavior rating inventory of executive function or degree, the T-scores are on the y-axis and the behaviors are on the x-axis. And you can see that for most of the behaviors, they are above the clinically significant threshold. So these are kids that really do have behavioral problems, behavioral and executive function problems, organization, planning, working memory, inhibition, initiation. They're all they're having problems, and these are some of the things that they're working on in the session. What you'll see here, this is the percent of time that during the video, well, when they're watching the video, we videotape them with the dog and we videotape them without the dog at different times. And what you see is we're measuring here time on task. So it's whatever the therapist is having them work on, and we're measuring how much attention they're paying and how much time they're spending on tasks. And notice that they spend, especially participants 2 and 3, are spending significantly more time on tasks when the dog is there than when the dog isn't. So it's tempting to think, well, the dog comes in and all the child wants to do is pay attention to the dog, but they really don't. It's really quite common for them. And, sometimes the therapist is using the dog as a tool, and sometimes the dog is just lying quietly there to sleep. This is looking at maladaptive behaviors. So you can see that this child has multiple diagnoses, schizoaffective disorder, ADHD, depression, and I think the bipolar, I believe it was. And so you can see she has 35% of the time without the dog. She was spending doing maladaptive behaviors, whereas when the dog was there, it was less than 5% of the time. This is the data that we get when we analyze these videos. This is for the child. So this is the time the child is agitated, the time they were looking at the dog. This is on-task behavior here. And so these are the behaviors we can look at more, but for now, this is what we're concentrating on. We also have the behavior or what the OT is doing and what the dog is doing. So we have all these, and these are all time mapped. So you see here, this is agitation in the child. And this is when the therapist comes in and starts doing a dog-centered conversation. So we can talking about the dog. And then the child here will touch the dog. And we have dog-initiated interactions down here. So you'll notice that when the child is redirected to the dog, then you start getting more of the on-task behavior. So this way we can actually monitor who's doing what. We also collect qualitative data in this study. The MOTA is a measurement of pet interaction. So the therapist would fill this out after each session. And this is the child that I was talking about that had the multiple diagnoses. This child had a pony, and she used to get on it by herself and ride the pony. And she had gotten to the point that because of whether it was gravity insecurity or her balance, whatever the problem was, she had stopped getting on the pony. Her parents could put her on the pony and she would ride, but she wouldn't get on by herself. And so the therapist had been working to try to get her to get on the bolster that was hanging from the ceiling in the kitchen center. And she wouldn't do it. They'd tried for 4 sessions to get her to get on this bolster. But the first session that the dog was there, it was a little black pug. They put the little black pug on the bolster, and then she crawled right up there by herself. She got on a box and got up by herself. Not only that, when she got home, she got on a pony by herself. And it was the first time in over a year she had done that. So this was something that they were taking home. It wasn't just in the moment when they were there with the dog, but it was something that was actually transferring to home. And the mother attributed it to the dog therapy. The other thing is the little girl she wouldn't brush. She had very long hair, and she only brushed the ends of her hair. And so they had her brushing the dog, this little short-haired dog that, from the middle of the hair all the way back. And then when she got home, she started brushing her hair correctly as well. And this had been something they'd been working on for quite some time. So the dog was demonstrating these behaviors. So we have animal-assisted therapy. It increased time on task when the dog is present. It decreased maladaptive behaviors. It provided tools for redirection during maladaptive behaviors, and the therapist reports improvement in reaching those 2 goals. So it was used clearly as a complement to occupational therapy because the techniques they were using were standard occupational therapy goals. They were just adding the dog into it. This is part of the same study, but I just wanted, we're also measuring what the dog is doing. And you can see there's a great variety. There's a difference. This is the number of times that the dog initiated behavior. And you can see that they really quite different. Kind of not surprisingly, the golden retriever initiated most frequently, and the border collie is least frequent. Wally, my beagle basset, did pretty good job too. This is another study that we're doing. This is the effects of animal-assisted therapy compared to progressive muscle relaxation on stress and anxiety. This is NO2 grad students. So we would bring the dogs in, usually about 5 at a time, and we have 5 of the grad students come in. We would measure their heart rate and blood pressure and have them take the state trait anxiety inventory. And then we would have them interact with the dog for 20 minutes and then take the assessments again. While they were doing that, another group was going through progressive muscle relaxation. And what we found, this is sort of not surprisingly, but if you notice, like the baseline was early in the semester. And then later in the semester, stress had gone up. This was getting more toward midterm, and stress was getting higher. This is with the dog, the animal-assisted therapy here, and this is with the progressive muscle relaxation. So they're both effective. They were both lowering the stress level, the anxiety level measured by the state anxiety inventory. But it's easier to get people to come in and sit quietly and pet dogs than it is to get them to go through progressive muscle relaxation. I've also been working with dog training, the effective dog training program on female offenders. They live in this dormitory-style housing unit at Vandalia, Missouri. This is a maximum security prison. It's part of the Missouri Institute, prison institution. trainers and assistants, we call them assistants, they're people who live in the same room. They have dormitory-like rooms, and the trainers usually share with one other person and their dog. They share. So it's not a cell. It's more like a dorm room, but small. And they share that with the assistant. And so those are the two groups that we used in this study. And then the women who are housed upstairs have very little interaction with the dogs. The dog training occurs in common spaces in the housing units outside of the yard. So the dogs are there 24/7. They're there for several months at a time. They come out for a while and then go back. And these dogs, most of these dogs become service dogs. And if they don't have enough service dogs in training, there's usually about 10 women trainers at any given time. They'll get rescue dogs from the Macklin Humane Society, and the women practice training them. This is kind of hard to explain in some sense, but what we're looking at here is the difference on the occupational self-assessment. You ask, is this, how well do you do this, and how important is it to you? And what we find on several of these, and especially this relaxing and enjoying myself, the difference in how they perceive their ability to relax and enjoy themselves and how they wanted to be was quite large the first time that we assessed them. By the next time, as they've been working with the dogs, then it decreased. So there was less difference. They were achieving, they were becoming more like what they wanted to be. We also found that these weren't significant. We did find that there was a decreased somatization, anxiety, and global severity. Now we're going to talk primarily about therapy dogs. So these are all at the Rehabilitation Institute. And here, this is the patient, the woman who's walking. All the dogs are trained to walk with the patient. Patients will walk farther if they get to walk the dog. If you're working on increasing the distance they'll walk, just let them walk a dog. Sometimes it's a matter of they don't want to come out of their room and even go to the gym to work. But if you tell them they can walk the dog there, they will. This dog had also been walking, and then here, this patient is brushing the dog, and she's working on her arm strength and hand grip. So the dog is a tool. There was a patient, a young woman, who had been in a drug-induced coma for like 7 weeks when she came to the Rehab Institute. She had been, I believe it was encephalitis, and she was getting better. But the first time she met my dolly, she said, "I want to keep her." And she could barely talk at that time, but she kept getting better and getting better. And one day, it was the first day that they had taken her out of her sling and set her on the mat, and they were working on building her core strength. And she sat there for 20 minutes. This was her first time that she had done this. And she sat there the whole time brushing dolly. And then after they put it, she went back to her chair. She whispered something to her mother, and her mother started laughing. She had told her mother, "You didn't have to do any therapy today." And yet what she had done was 20 solid minutes of sitting there working on her core strength, and she didn't even realize that she was doing therapy. These are 3 of my favorite dogs. Only one of them is really mine, but this is a Cardinal Brennan. We do animal-assisted activities with them there. And I know you're not supposed to have favorite patients, but this was one of my favorite patients ever. She had locked-in syndrome. And the first time I met her, just for a second, she caught my gaze. She couldn't even hold her eyes. She couldn't even control her eyes. But you knew in that second that that she was cognizant of everything that was going on. But she couldn't lift her arms. She couldn't do anything. But she loved dogs. And so the therapist realized that she was getting movement when the dog was there. We would help her pet the dog. So we visited this patient every Friday for 7 months, and then every other Monday. And they invented a game. And the therapist had told the patient to lay down on the mat and practice turning the head from side to side. And it just happened, this is my dog, Sheila, my first therapy dog. And she happened to turn her head at the same time. So it became a game. And they would do that. They would go left, right. And then the patient would deliberately get out of sequence so that Sheila would give her a kiss. And it was really fun. But she did wonderfully. And by petting Sheila and stroking her, the way that she would use her hands was the way that the same movement she later used to control her wheelchair by being able to push it forward and back. So it really made a difference, I think, to her recovery. Now you can just jump in here if anybody wants to unmute themselves, and you can all jump in here. What if your goal was to improve balance and coordination? What kind of AAT skills did you use with the dog? You can use a cat. That would be okay too. You can throw a ball and have them retrieve it. So they stand and they throw a ball, they have to, to retrieve that. With speech, you give the dog simple commands or play games with the dog. Fetch, bring it, sit, down, stay. You can tell them all these things. And it's amazing what that will do when they can concentrate on the dog and they're not worried about people listening to them. It's like something is unlocked with speech. It's absolutely amazing. To build endurance, you can take the dog for a walk, make up games like do those exercises. For standing balance, you can have the patient kick a soccer ball and the dog returns the ball. You can play basketball with the dog. Stretching, you can brush the dog from head to tail, to toe. Which reminds me of another patient that the OT was working with her. She was ready to go home, but the OT was trying to get her to tie her shoes, and she was afraid to bend over far enough to tie her shoes. She could do it, but she was afraid to bend over. So I brought Keela in. We put Keela right in front of her, and the OT and I were kind of chatting and watching. I gave the patient a brush, and she's brushing Keela. And she keeps brushing her and brushing her. And a little bit, we look at her, and she's bent all the way over brushing Keela's feet. And the therapist said, "Do you see what you're doing?" And she didn't realize she was bent over far enough to tie her own shoes. But she didn't think she could do that. But once we distracted her with the dog and being able to distract the dog, she discovered she could. She could bend all the way over. For memory, we do Q&A, so we can tell them things about the dog and wait a few minutes and ask them. And we can also change thoughts, like giving sequence commands, get it, hold it, give. So there's all kinds of ways. There's just, there are many, many, many ways that you can use a dog to improve skills. It's almost limitless. These are two wonderful books. They're just little, show you here. They're just little, kind of almost little workbooks. But they are edited by an OT, and it's actually, there are pictures, and it tells you how, what you're working on and how to use the dog and what kind of skills the dog needs. They're just great little books, and you can order them. They're about $20 each, and you can order them from Amazon. But they're really, really helpful. So if you're thinking again about therapy dogs, there are basically two different kinds. Something that's becoming more common now is residential or facility dogs. And the dog actually, it will stay with someone who may be a nurse or a DOT or the vet therapist. It will live with them, but come to work every day and be available every day to work with the patient. This particular dog, his name is Higgins. He was a golden doodle, and he worked at Cardinal Glennon for many years. And they would, the kids could go in and he would go to get measured, especially kids with autism. They would examine the dog first, and then the child would let them examine them. So some of the things you need to think about is the effort that it takes to find and train a dog. But the dog is always there and is always available. There are costs involved with it, such as vet care and food and so on. And you've got to find somebody who cares for the dog, someone for the dog to live with. This is a very special dog. Her name is Rita, and she works at Child Center. She's partnered with a forensic interviewer and helps kids be brave while they relive the most horrible experiences in their lives, physical and sexual abuse or abuse of others that they've witnessed. She has been so helpful that they've actually trained another dog, so they have two dogs that are available all the time. They've also trained a dog to be present in the courtroom when the kids have to go to court. They can actually have the dog sitting by their feet, which is it's wonderful. According to Rita, I landed my dream job lounging on a comfortable couch and comforting kids during a rough time. The other option is the visiting teams. CHAMP is the organization I've volunteered with for the last 20 years, but Duo Dogs, Love on a Leash, there are many others as well. But the dogs come trained with a handler. You have intermittent visits, usually once or twice a month. It's a free service. You have a variety of dogs and people. And you have scheduled visits that become part of the recreational program. And you can see what a difference it makes for people when they're visited by these dogs. The volunteers can be unpredictable sometimes, like as all humans are. So again, it's an effort to find and train the right dogs, the facility dogs, but the dog is always available. There are costs involved, and you have to determine who cares for the dog. The dogs come trained with a handler if they're visiting teams. The intermittent visits, cost is free. A variety of people and dogs and scheduled visits become part of the recreational program, but there's some unpredictability about it. Possible issues with therapy dogs. People may be afraid or allergic, although I've been surprised at all the years I've been working with therapy dogs, how few people have really complained about being afraid or even being allergic. But we're always careful about that. We'll never enter anybody's room or anything without checking first. Volunteers can be unpredictable. Dogs can be unpredictable. The staff, you need staff time to accompany the therapy dog teams as they visit the room. So some of the best practices for starting a therapy dog program, the purpose. Why do you want a therapy dog? Is a therapy dog going to be able to meet the purpose that you want them for? Some of the considerations: do you want a facility dog or visiting dog? Is the staff agreeable? Consult and educate them. Sometimes we'll go into a new facility and people aren't too happy with it. What am I going to do with these dogs? So once they've seen them for a while, after a while, the staff is just happy to see them, or more so than the patients are. That the agency supplying the dogs, the training costs, the reputation, find out, how long they've been around, that sort of thing. Define your requirements for dog and handler, and schedule visits from the staff or administration and supervisors. So overall benefits: therapy dogs are cutting edge, they're evidence-based, and they're cost-effective. They're a means of improving the quality of life for residents, patient, and customer satisfaction, and overall facility quality. I want to spend the rest of the time now talking about a little bit about public access dogs and some of the rules and regulations. So do you ever wonder, is that dog supposed to be here? That sort of thing. So for public access, it's the Department of Justice regulations that supervise service dogs. For housing, it's the Department of Housing and Urban Development, the Fair Housing Act. They monitor service dogs and other types of assistance animals to perform tasks, provide emotional support, or alleviate the effects of disability. So the Department of Justice does not consider emotional support dogs to be the same as service dogs, whereas the Department of Housing and Urban Development does. And air travel is up to the Department of Transportation, the Federal Aviation Administration, and the individual airlines. The Department of Justice regulations define a service animal as any dog individually trained to do work or perform tasks for a person with a disability. Dogs need not be marked in any way. No special tags or tapes or vests are required. The dog need not have papers, be certified or registered. They can be any breed or any size. So you can't, in other words, you can't tell by looking at them whether they're service dogs, whether they're legitimately service dogs. A person with a disability has the right to be accompanied by their service animals in most places where the general public is allowed. They may not be treated differently than other visitors. Service dogs may be excluded from specific locations where the dog's presence constitutes a hazard, such as hospital operating rooms or burn units or certain places in the zoo, because the animals are so afraid of. Service dog users may be required to remove their dog if it's out of control or poses a direct threat to the health and safety of others. I would hope that would not be a certified therapy dog. How do you tell if it's a real service dog or not? You can go online and to Amazon or most anywhere and buy a service dog vest for about $30. So some, but not all, real service dogs wear special collars, harnesses, or backpacks. Some, but not all, fake service dogs also wear special collars, harnesses, or backpacks. So it's hard to tell. You can't tell by looking. Per Department of Justice regulations, you can only ask the following 2 questions of anyone who has a service dog. Is the dog a service dog required because of a disability? And what type of work or task has the dog been trained to perform? That's the only 2 questions you can ask. You may not ask about a disability, require medical documentation, require training documentation or certification for the dog, ask if the dog demonstrates skill. So it's like I think they're really trying to tighten up some of these rules and regulations because there are so many fake service dogs now. And most good service dog providers are in favor of that. They would rather have it. They should be certified. But that, I think that would be changing. Service dog etiquette, help the dog be successful. if you see a service dog, if you're out and you see a service dog, the hardest thing to do is to ignore the service dog. I want you to pet the service dog. You don't use the dog's name. You can speak to the person, but not the dog. You can say that's a wonderful dog, but you can't look at the dog and say what a wonderful dog you are. And no touching or eye contact. Don't feed the dog. They get lots of playtime, but when they're in public, they are working professionals. Let them do their jobs without interference. And that's hard to do sometimes because they're so adorable. So let's say you have a dog and you want to make it, or I can't. You want to make it a service animal. The most important thing is that they be people friendly. This is my dog, Sheila, my first therapy dog. They need to be calm, obedient, non-reactive, and okay with other dogs. This is, at the end, I put some resources and reference. I think that's all. If you have any questions, I'm happy to answer any questions you have.
Hi, I'm a second year occupational therapy student still, and I'm interested in getting into this field. That's why I attended this conference or recorded lecture. Do you have any recommendations to do so, or how to get started, or with that?
Where are you going to school?
Yes, at Cox College in Springfield, Missouri.
Okay. I'm actually from that area.
Okay.
I did my undergrad at Missouri State.
Oh, awesome. Cool.
Yeah. And I'm trying to think. The first thing I would do if I were you is go online and find a therapy dog organization.
Okay.
And you can volunteer with them. Do you have a dog that?
I have a dog. He's a 2-year-old lab, so he's still a little hyper at the moment.
Yeah, so. They usually, with labs, they usually need to be about 2.5 before you start training them. But it's amazing what they'll do. Most organizations will actually have training classes.
Okay.
And so you can do that. But that's the first thing that I would do is look around. I'm sure that there are organizations down there. Feel free to get in touch with me.
Okay.
And I'll see what I can find as well.
Okay.
And then once you get started, it's not too hard to find places to visit. Most places do want dogs to visit and so on. But that's where I would start, is to find a local therapy dog organization.
Okay. Thank you.
Sure. Other questions?
Regina, did you face much difficulty trying to bring dogs into hospitals or into some of the adult rehab centers? I know sometimes they can be more restrictive due to sanitation guidelines than kids' places.
It was not hard at all to get into the rehab institute. They've been real champions for us the whole time. And when the reg therapist there is the person who arranges our visits. And when they changed reg therapists, they've always tried to find someone who is in favor of animal-assisted therapy because they really believe in it over there. It took us a lot longer to get into Barnes. We visit Barnes, and in fact, when we first started going there and we were doing a study, the only place we could go was to the psychiatric unit. They figured you couldn't catch that, I guess. But when they began to see how well it worked, we now go over there. We sit at the fountain, and people just come by and pet the dogs. We visit rooms. They've really become champions for us too. Once you get your foot in the door, they realize it's not that much of a problem. And so yeah, but sometimes you do have to fight to get in. We haven't been able to get into Children's Hospital yet. We go to Cardinal Glennon. Been going to Cardinal Glennon for over 20 years, but they have a different group that comes in there, and so they're afraid to bring in anybody new. So we'll get there someday. But yeah, it can be kind of tough. You have to. It was really interesting, the study that we're doing with the women's prison. There were no prisons in the state of Missouri that had a dog training program, and Champ was the first one who went in and set up this program, and it worked so well. Every prison in the state of Missouri now has a dog training program. It's a wonderful place for OTs, I think. You know, there's a real need for OTs that you can get into the prison. But, yeah. Any other questions?
Well, I guess maybe it's not really a question, but I read an article. I saw an article today. I think it's Washington University has a prison reentry or recidivism reduction program now, and for OT. And I know that some prisons have dog training programs for the prisoners. So I was wondering where might therapy fit in, like dog animal-assisted therapy fit in there.
Well, part of it is, like I say, every prison in the state of Missouri now has a dog training program, and what they use it for really is they learn so many skills that transfer into the post, you know, like the transitional period, and they have to work together. They have to, you know, there's decision-making abilities. There's, I mean, you're there with the dog. The recidivism rate for people who come through these dog training programs is like it's less than 5%. And of course, it's like more like 70% in the general population. And it's something that the skills that they need to get to do this dog training program, I would love to see other programs, other types of programs started that use those same kind of skills. I know SLU also has a recidivism program as well, a reentry program. I'm
sorry, who does?
SLU, St. Louis University.
St. Louis. Oh, I think that might be what it was. St. Louis University.
Yeah, I know that they do. I think there are some people who are working on prison programs at the main campus. But yeah, I do know that St. Louis University has a program. They work at Bon Terre primarily with the men at Bon Terre.
Yeah, I think that's who it was actually, I heard.
Yeah.
I think it would be helpful too in like juvenile offender programs too.
Yes,
to kind
I do too.
Yeah.
They've used some, there are some juvenile programs that do bring dogs in. There are even some locally that they'll bring dogs in.
In St. Louis?
Yes,
I'm in Kansas City, so it seems like it would be very helpful here. I haven't heard anything about that though in this area.
Yeah, you might do some calling and see what you can find out.
Yeah, I think yeah.
Yeah, just see what you might have to say about it. So I bet there is some kind of a program somewhere.
I will do that. Thank you.
Yeah. Any other questions? It's been a pleasure.
Thank you very much.
Sure.
Thank you.
Thank you so much, Dr. Abel.
Hey.
I found the information about cortisol levels really interesting.
Oh yeah. You see what I have sitting on my desk?
Oh, the planter I gave you. Okay, I'm gonna stop recording.
Yes.